Welcome to Dr. Jeff Talks About Sex and Intimacy, the podcast where we explore anything and everything relevant to sexual health, relationships, and intimacy. You are tuned into episode 43, The Basics and Beyond of Outercourse, Creative Pathways to Pleasure. I want to take a moment to sincerely thank you for joining us live or on the recording. I know how valuable your time is, and I can't tell you how much it means to me that you took time to learn this important information. And I'm so grateful for every single one of our listeners. So thank you. You are what this podcast is all about and why we're here every Tuesday, 7 o'clock. I don't know if you know, but I'd like to remind people that October is Breast Cancer Awareness Month. And I want to once again honor and acknowledge everyone who is living with breast cancer or a survivor of breast cancer. And I'd just like to say it has truly been an honor and a privilege to be a part of your journey, those of you who have come to my clinics. And I know all of us here really appreciate the heroic things that you live every day and letting us into your world to help you have a healthier, more wonderful life. We are out there on social media. We're out there on Facebook. We're on YouTube. We're on X. We're on LinkedIn. We're on Kick. We're out there. If you're on X and you have a question, you can go to LinkedIn, Facebook, Kick, or StreamYard to submit those questions. If you are a Facebook person, we always need followers because the more followers we have, the more Facebook will allow us to do. So please follow us if you're a Facebook person. We really appreciate it. The website has so much valuable information. Remember, there are 42 previous episodes, and this one will be there too. After we finish, the recording will be there as well. So you can watch any of the old episodes with the amazing guests. You can pull up the calendar and see all the great things we have coming through the end of the year and into the next year. So please go to the website. Listen to us. We're where you are. We're in your car. We're on your favorite streaming service like Spotify, Amazon Music, and iHeartRadio. We're there with you. So when you're working out, when you're riding along in your car, when you're on those trips, take us with you. Listen to us and please tune into our podcast. Lots of great information. I want to just remind you, as I always do, that all are welcome here, everyone. Whatever your sexual orientation, whatever your relationship style, your gender identity, you are so welcome here, and we are so glad you tuned in. The goal of the podcast, it's pretty easy and simple. It's really just to enlighten and empower you with the information you need, the evidence-based scientific information to make informed decisions to improve sexual health and deepen your relationships so you can live and love more wholeheartedly. And that's my hope and prayer for you. This episode tonight, oh my gosh, I'm really excited about it. We've already been talking in the studio, the other panelists and I, and we're diving into a topic that is often misunderstood, it's underestimated, and yet it's incredibly powerful. Outercourse, the wide, creative world of pleasure beyond penetration. Most people a lot of us feel sexually undereducated. And when we started our sexual journey, maybe quite inadequate as a lover. It doesn't come with a great manual out there. There are things out there to find and great resources, but most of us felt ill-equipped. And some people never really even were given accurate information on their anatomy and physiology. People with penises, people with vulvas don't even know or understand their own or their partner's anatomy and physiology. So we're going to explore a little of that and the basics and go beyond that. We're unpacking all of that in this episode. And whether you're navigating pain, desire discrepancies, erectile changes, trauma recovery, menopausal transitions, or if you're simply wanting to expand your erotic repertoire, Outercourse offers endless possibilities for connection, arousal, and some great intimacy. So, to explore the basics and beyond of Outercourse, I'm joined by two powerhouse experts who bring deep wisdom, compassion, and innovation to sexual health and pleasure-centered care. We have together seen thousands of patients with sexual issues. And together, we're going to discuss what Outercourse really means, why it matters, why talk about it, and how it can open new pathways to pleasure for individuals and couples of all genders, ages, and identities. So, our panel tonight starts with myself. Most of you know I am an advanced practice urology clinical nurse specialist with full prescriptive authority to evaluate, manage, and prescribe for my patients in my clinics. I'm also a certified sexuality counselor with more than 30 years of experience treating sexual dysfunction. I'm also trained with the Gottman Institute in couple therapy, as well as with Andrew Christensen with integrated behavioral couples therapy. And my PhD work examined the impact of sexual dysfunction on men with prostate cancer and their quality of life. Dr. Susan Kellogg-Spatt has been a wonderful guest and a guest host as well on this podcast. She's amazing, and most of you are familiar with her. She is a nurse practitioner and a renowned pelvic and sexual health expert with over 30 years of clinical leadership in female sexual medicine, vulval vaginal pain disorders, and integrative sexual health care. She's a certified sexuality counselor as well, like I am. She's a pelvic health specialist, a researcher, an author, and a beloved educator. And she's known internationally for her compassionate, evidence-based approach. And she is my go-to person in female sexual dysfunction. Also, another guest that has been on our show a couple times is Alicia Williams, and she is amazing as well. She is a licensed clinical social worker and an AASECT certified sex therapist specializing in intimacy, erotic exploration, sexual identity, and pleasure-focused healing. Known for her warm, empowering therapeutic style, Alicia helps individuals and couples rewrite sexual narratives, reconnect with their bodies, and develop creative sexual practices that foster joy, desire, and deep relational connection. Her work centers on inclusive, trauma-informed, pleasure-forward sexual health. I love it. These are two of my favorite people, and I am so excited to have this discussion with Susan Kellogg-Spatt and Alicia Williams. Welcome.
Hi. Glad to be here.
What a great discussion we're going to have. So let's kick it off. We have a few slides, and then we're just going to talk. There's so much we could talk about that we may have to do a second episode, but here we go. All right. I'm going to give this over to Dr. Kellogg-Spatt.
All right. So let's talk about Vulva 101, my favorite topic. But, the vulva can be a mystery place. If all you've ever had during your sexual exploration is kind of lights out, hands under the covers or hands down the pants and kind of like just trying to figure out what's going on, there's so much going on in the vulva. So we're going to get up close and personal with the vulva. Let's start with the shaded area up top. That is a hair-bearing or formerly hair-bearing area, and many of you or us that don't have hair anymore because we decided to take it off, and either is fine, I'd like to point out. But that is going to show you where pubic hair would be. If you looked under the pubic hair, however, you'd see lots and lots of structures. So we're going to look under there, and we're going to start out wide, and you'll see two like parentheses almost, and that are representing the lips or the labia. There's two labia. One is hair-bearing or formerly hair-bearing, and that's called the labia majora. And just inside that are thinner, small lips, also in a parentheses fashion, and those are the labia minora, or smaller labia. Now, people think, labia are just something to shave and get out of the way for penetration, but then that's not true at all. The labia are very, very sensitive. They have erectile tissue in them, and they very much contribute to a woman's sense of arousal and pleasure. So do not leave the labia alone, and do not push them out of the side, because they love you too. And so having the labia stroked or licked or rubbed gently in either a longitudinal way or in a round way, that all feels great. And so those are the labia majora and minora. If we keep looking inside, then if you go to the very top of this, again, the labia majora on the outside, they have the shadowing because they have hair, and the labia minora have no shadowing because they don't have hair on them. If you look at the top, however, you'll see where the labia minora come to a peak at the top, and there is a small round structure there that is called the clitoris. The clitoris is a round structure that has a small hood that goes over the top of it, and that is called the clitoral hood. Part of why the clitoris has a hood is almost why you have an eyebrow or an eyelid on your eye, because the clitoris is so sensitive that it actually feels better sometimes if the clitoris isn't directly touched or licked or probed, but if it actually is gently rubbed or checked or probed underneath a covering or the hood. Both of these structures have erectile capability, and so when a woman is aroused, the clitoris gets engorged with blood and actually gets hard to the touch. Moving on. Actually, Jeff, Alicia, I'm going to have you take it from here because I'm having some technical difficulties. So, Alicia.
Okay, hold on. So a couple things I was thinking about, Susan, that as you were talking is, number one, a lot of people think the female genitalia is the vagina, but the vagina is the canal. It is not the vulva is everything exterior that you see in these two. This is a diagram, and this is a little more of an illustration. So in this diagram, when you look closely, you can see the vagina is that the entrance to the vagina, the vaginal orifice, that is the canal that leads in there. When you separate the labia completely, that area right outside where you see at the top the clitoris, then you see the urethral orifice, you see the vaginal introitus, all those things, that whole area around there is called the vestibule. It's like, think of it like if you've ever been in a church, it's the area just outside the entrance to the church. It's the area just outside that sacred vagina in people with vulvas and vaginas. So that's what you're seeing there is some of that. So right below that little bump, are you back, Susan?
I'm not actually, but I'm listening attentively.
Okay. um, and then so below that little bump or that clitoris with the clitoral hood, you see the urethral orifice or opening. Below that is the vagina, and that's the vaginal orifice or introitus or entrance, and then the rectum down there at the very bottom as well. Alicia, did you want to speak to or add to any of this anatomy?
Well, I popped off the screen for a second because next to my therapy chair that I sit at every day, I have a little 3D clitoris model that I keep for demonstration purposes. So you can see at the top of this illustration that the clitoris is there. And when you observe a body from the outside, a body with a vulva, you're going to observe this. And like Susan said, all of the genital tissue for women is, or for people with vulvas and vaginas, is erectile tissue, just like tissues for people with penises. And so this would equate to the head of the penis, and there is typically a flap of skin that covers over the head of the clitoris, which will retract. And so as all of this tissue gets engorged, then we have more access to the pleasure center. So this would be the external piece that we could access. And then all of the rest of this, the legs and the bulbs, all of this is internal structure, but an important part of the genitalia.
That is awesome, Alicia. That's so great. I'm so glad you showed that too. And if you look at that, you'll see too how similar those structures, especially those internal structures, full of smooth muscle and erectile tissue, as Dr. Kellogg said earlier, it looks almost identical to the structures of the penis. If you ever want to pull up on Google Images, you will see side by side, they are so incredibly similar. The urethra comes through the head of the penis,
Yep.
And the urethra doesn't come through the clitoris, but they are very similar structures. That is awesome, Alicia.
So the urethra would be more, let's see if I can get a better
Yeah.
sort of, the urethra would be more like in this place. What we're
Yes.
thinking about, and then the vaginal opening is typically here. And so one of the reasons why this is so important is because if we think about the way that pleasure and arousal is experienced, if this is erectile tissue as well, then we need cognitive experiences and physical experiences, arousal experiences that fuel the engorgement of this tissue, right? Which then contributes to pleasure. So what we generally think of as the G spot, which isn't necessarily anatomical structure, but an area. The G spot is sort of in this area. And the theory is that when there's engorgement, right, and arousal of all this tissue, pressure that is some pressure on the head of the clitoris, some pressure on these bulbs, right? And some pressure on that sort of urethra, right? The spongy tissue that surrounds the urethra, all of that can go for some people to experience some pleasure. So it's why it's important to know what this structure is. It may be interesting to you, Jeff and Susan, to know that I sometimes do talks for women's groups or bachelorette parties or girls' nights where people will want to have a conversation about sex and pleasure. And I brought a bunch of these and I handed them out and I asked, this was for a 40th birthday party. And I asked, who knows what this is? And out of 30 people in the room, 2 people raised their hand.
Wow.
And then I said, if I had just held up a 3D model of a penis, how many people would have raised their hand? And every single person raised their hand, right? And so I said, part of the experience of having a limited view of what sex and sexuality is an incomplete understanding about the about the anatomy and the function of anatomy, right? This vulvar and vaginal structure is complex, but so is the structure, the anatomy of a penis and testicles, right? And prostate. All of these things are complex, but they're knowable. They are learnable. And one of the things, because this is sort of hidden away inside with maybe just a little peekaboo happening with the head of the clitoris, is that we sort of see this, or historically have seen this as a not important piece of anatomy to understand, along with, I loved what you said, Susan, about a lot of people experience pleasure or enjoyment from, stimulation of the labia, of, the pubic bone or the mons, right? There are all of these parts of the genital region that are rich with nerve endings and pleasure receptors.
Exactly.
Right?
And what I think is really interesting in this model, and yes, I'm back, is that if you look at where the opening of the vagina is, and that's a very gentle lavender color, at least on my diagram, look right above that, there's the urethra. And this helps explain a couple of things. For people that have recurrent urinary tract infections, or they have urethral sensations with sex, either good or bad, look how close the opening of the vagina is to the opening of the urethra. So that's one thing that's very important to know, and why it's a pretty good idea to empty that bladder either before, after, or both the sexual penetration, because you want to be sure that no bacteria from sexual play gets up into the urethra and causes a urinary tract infection. So it's not your fault if you're one of the people that gets them, by the way. It's part of anatomy. Everything's quite close together. So the other thing I'd like to point out is that little beautiful lavender oval, the opening of the vagina, is quite a bit lower, isn't it, than the clitoris and the clitoral hood. And sometimes women are confused, or people with vaginas and vulvas are confused because they aren't having an orgasm or feeling maximum pleasure when they're having penetration in their vagina. look how much more south the vagina is. And so sometimes there isn't enough clitoral stem or clitoral labial stem or clitoral hood stem to really feel highly aroused. So knowing where parts are and teaching partners where our parts are is really part of the whole pleasure solution that we're talking about tonight.
Yeah, and you mentioned, Alicia, the G spot. And so you see that vaginal opening, and typically if whatever is inserted, but a finger up to that first knuckle, that first joint, not knuckle, but that first joint, usually right inside the vagina. Now you're pressing upward. What's right above it? That back side of that clitoris, and that is the area where the G spot is. So if people are like, well, where's the G spot? It's a big mystery, right? Well, we're here to tell you what that mystery is. It's not a difficult place to get to, and it may be sensitive in different ways for different people. What do you both think about that?
I think some women find it absolutely divine to have that area stimulated, and other women can't stand it, to be quite frank with you. They feel way too much urethral pressure. They feel like they have to pee the whole time it's being stimulated. And so it depends. If you love it, go for it, own it. But if you don't love it, tell your partner that you don't love that, because that's, again, sexual communication, hugely important to have pleasure.
And what an important message right there. Remember, everybody's different. And guess what? Today, your partner may be different than they are a week or a month or a year from now, and what they want and what feels good and what they enjoy. So it's always discovering and rediscovering what they like and what they want. That's a good lover.
Yeah, absolutely. Absolutely.
Here's another drawing, more of a drawing illustration of those different parts as well. Anything else before we go over to the male genitalia? And we're going to obviously talk more about pleasure with people with vulvas and pleasure with people with penises.
One more thing, Jeff, and that is in the two different pictures and even two different women, the labia majora, and that's the hair-bearing labia, and the ones that have fat tissue in them, and then the labia minora, the non-hair-bearing labia, are different on all women. And so if you have seen pictures of naked women, or you've been in a gym class and seen naked women, or you love a naked woman and she has different labia than you do, or a different configuration, there are as many different labial configurations as there are noses and eyes and ears on a face, and most are well within normal limits. And so if you're questioning that, certainly go to a sex educator, talk to your gynecologist, talk to your PCP, whoever examines you, because part of what I do, and I'm sure you do too, my co-hosts, is that you talk to patients about how normal their genitals are, because otherwise people can only go by what they see in films or in pictures, and they're like, I'm not normal, mine are too long, mine are too short, mine are too fat, mine are too thin, and the truth is they're probably all very normal.
I have multiple patients who are like, oh, look at this, I hate my labia. And I have a friend who said too, I have a very strange labia I don't like. And I'm just like, oh, they're all different, and they're folds, and they're all beautiful and different and rich with nerve endings. So love on them, don't hate them.
Agreed.
Okay, so as we move over to the male, so a couple things. Now, remember, you have those very similar structures. You have that pendulous urethra, which is the part of the urethra that hangs outside the body in the penis. So much, remember, the clitoris is a little bump up there, and all this is outside the body in the male, all of this. So it is different. And so that's important to remember. Let's go back to the diagram. And and we also have a hood on the penis. It's called the foreskin. So remember, these structures they start from the same embryonic origin, and one turns into a clitoris from DNA and one turns into the penis. And so they're very similar. And so inside are all these erectile cylinders. Like Susan, I want to use my pointer, but we're unable to do that, show you all that. But inside are all these smooth muscle, blood vessels that become engorged and when you're aroused. But they're not going to become engorged unless you're excited from tactile stimulation on the penis or on whatever feels good, on the man's nipples, wherever it feels good for him. Tactile stimulation on the body, or psychogenic stimulation, even better, both, right? And so then we have the penis, we have the opening is called the fossa navicularis. And then down here, let me show again, Vic, let's show a little closer this. And so we have, this is called the glans. It's the head of the penis. This is a model. So you see the opening. Most of our openings don't look like that. They collapse back down on themselves. But you have the glands, that carrera, the edge of this, all that area, and this is obviously missing the foreskin, which would cover and completely cover the tip of the penis, and so that whole area can be very sensitive. The shaft, any of that can be. They're very nerve rich and sensitive on most men, and men enjoy. Everybody's different, but stimulation on all those different areas, potentially the underside of the penis as well. That foreskin, just like the hood, was sort of protected because this may be a little hypersensitive for some men, especially if they had to have a circumcision later in life, because it was used to having that protective skin over the top of it. So that's important too. And then down below, we have the testicles, the scrotum, all that kind of thing as well. Let's go back to the diagram. Thanks, Vic, he's always ahead of me. He's right with me. So thank you. He's awesome. So you can see in this diagram, if we pull out a little bit, we see up there at the top, the bladder, which is inside the body. Right below it, we see the prostate gland, and you see that line going through it. That's the urethra that comes, and that's where the urine comes out of the bladder, and it goes right through the middle of the prostate and out the urethra down through the end of the tip of the penis where it comes out. Now, that opening can be displaced. It can be displaced on the underside or the upper side of the penis as well. It could even be down along the shaft. That can happen. There are things called epispadias and hypospadias that can occur, and it can be displaced. But typically, the fossa venicularis is at the tip of the penis, and that's where it should be. But if it's not, sometimes that's surgically corrected. Sometimes if it's not a really big problem and it's slightly displaced, it's not a problem. But there's also then, you can see, as we saw the bladder, up above the prostate, right above it is those seminal vesicles as well. Now remember, that fluid that is ejaculated out comes together. Even the sperm that comes down there from within the testicle matures in the epididymis and then travels up to the prostate and seminal vesicles. All that fluid mixes together. The fluid that comes from the other glands, like the seminal vesicles, they nurture and they feed the sperm so it stays healthy, and also so it can survive in the more acidic vaginal area as well. So, but again, these are some of the areas right behind the scrotum, back behind the scrotum. If you were to reach behind the scrotum, that's the perineum that you feel underneath there between the scrotum and the rectum. And that can be a wonderful source of pleasure for some people as well. The rectal area can also be very enjoyable and pleasurable for some men. And some men even like the prostate to be stimulated as well. All of that is full of nerve endings that can be pleasurable for some people, and again, could be even uncomfortable for other people. So it's discovering what is pleasurable for your partner if your partner has a penis and scrotum and some of these, this anatomy. So just remember those different things as you're thinking through that. And that is a little bit of a quick anatomy and physiology lesson. So the penis, so what happens? How does an erection even occur? When a man gets excited from tactile or psychogenic stimulation or both, it's all put together in the frontal lobe of the brain. The message goes down the spine through the autonomic nervous system to the peripheral nerves, which go to the penis. Those nerves come off the tailbone, wrap through the colon and around the prostate, a bundle on the right, a bundle on the left, and go to the penis. When the nerve impulse gets to the penis, it activates chemicals in the penis that cause the smooth muscle to relax, the blood vessels dilate, and fill the penis with blood. That's where the engorgement comes. There's 7 or 8 times more blood in the penis when it is engorged versus flaccid. And when it becomes engorged, it squeezes those superficial veins closed so the blood locks and stays in the penis, and that's how an erection occurs. So Okay, that's a lot of anatomy and physiology. So let's go on to outer course. Hopefully, did you either of you have anything you'd like to add to anatomy and physiology on people with penises?
Not on with penises, but it was a very lovely explanation, Jeff. And what I'd like to point out is that remember that the clitoris is the analog of the head of the penis for people with vulvas. And so there can be stimulation that's tactile, as you pointed out, or psychogenic, as you and Alicia both pointed out. And so that can happen and cause the same chemical reaction in the brain, the spinal cord, and the blood rushes into the labia and the clitoris becomes erect. So truly, we're not very different. The genders are not terribly different. They're quite the same when it comes to sexual arousal.
Definitely. But what's the biggest sex organ in the body? The brain. The brain. The roots of your pleasure are in your brain. The brain is wired for reward, not just logic, but also for reward. So that mesolimbic dopamine system, it's an ancient pathway driving that motivation for not just sex, but food and safety and sex. So that's what that mesolimbic dopamine system does. The sexual activity activates a reward circuit, releasing dopamine, very important chemical, dopamine, to heighten desire, to focus and anticipate that sex that's going to occur. The hypothalamus releases the cuddle drug, oxytocin and vasopressin, fostering the cuddle chemical. And that fosters emotional bonding, actually making us want to bond deeper and more closely with attachment to that partner or whoever we're with, potentially. Sensory signals from the genitals travel to the somatosensory cortex, that's in the brain, mapping physical pleasure in the brain. Orgasm is completely a full body experience. It's a brain body experience, blending emotion. It's miraculous. It blends emotion, sensation, cognition, and into one integrated event. And it feels, a lot of people describe it as it feels like you've had an itch that was desperately needing to be scratched and it was satiated or scratched. Lots we can talk about with that, I'm sure. Anything else from my co-hosts on this roots of pleasure in the brain? There's so much to unpack there.
There's so much information. When you think about your comment about emotional bonding and attachment, it's a chemical reaction. So after an orgasm or after sexual play with a partner, you just feel closer. You really do. You feel like really close to them. And sometimes people think, well, that's because I had a great orgasm, but it's even more chemical than that. There are chemicals that are released that help us foster intimacy, really true emotional bonding. And I think that's the coolest thing of all. It's not just a physical response, it's a full body, mind body experience of bonding. Just like that's why they call it sex and intimacy, because the intimacy is built in.
Mm-hmm. So cool. Well, Alicia, I'm going to hand over to you to introduce our listeners to Outercourse.
Thank you. You know, we've been talking about the anatomical structures of our genitalia, and as you so clearly stated, Susan, there are lots of different ways that these genitals can be organized, right? That they can look differently, but one of the things that we recognize is that we often have this expectation that sex, right? If someone says sex or they had sex or do you want to have sex, that it feels like it brings with it this heteronormative, scripted process, right? Progression of events, erection, penetration, ejaculation, right? And I think over time, there's been much more of an effort to center a variety of different kinds of partnerships and orientations and identities, so that it's not just a person with a penis and a person with a vagina having, right, a penetrative experience, but it is an intimate, pleasure-based, right, sort of experience. And so with that, I really love to, I was saying this earlier to my colleagues, that I really love to share with my clients the idea that I think we should decouple the terminology sex from intercourse and talk about intercourse, but let sex be this much bigger umbrella of touching and arousal and eroticism and pleasure and intimacy, so that we have many more opportunities to be successful, right? Because if we're talking just about penetrative sex, then if for whatever reason you don't fit that progression that I was talking about, then you may feel like you had failed or an incomplete experience. You may be in a relationship where those particular combination of genitals don't even exist, so you don't relate to that terminology. Or you may be a person who prefers sexual stimulation that doesn't involve a partner, right? So it may be solo sex, or it may be that you're a person that likes to read or look at erotica or have fantasy space. All of these are sexual behaviors. So when we think about outer course, the terminology there really is intended to be inclusive of sexual activities that don't focus on penetration. Now, sometimes people will combine those things, so they will have experiences of kissing, hugging, rubbing, touching, stimulating, that don't include penetration, but then maybe the activity will also include penetration, right? And sometimes people have a complete experience that only involves touching, that's exclusive of penetration. So I think in this conversation, our intention is to do a couple of things. One, to normalize, right, that sexual activity that doesn't focus just on erection, penetration, ejaculation, completion, which leaves a whole lot of people with clitorises out of the pleasure script, right? But also gives us an opportunity to be curious about what our sexual scripts might be. To your point, Jeff, about sometimes people might feel underinformed. They might feel like they don't have sufficient knowledge about sex. And so I think the default position or the shortcut to being sexual is sort of this like, well, this happens and then you put it in this thing and then, right? And so some vulnerability, what you were talking about, Susan, about people having a little bit of vulnerability around the appearance of their genitalia, particularly labia, right? Hair or no hair, those kinds of things. It might feel kind of uncomfortable to think about exposing your genitals to another person if either you don't know how to interact with them or you feel uncomfortable about the appearance of your body. And so this is an opportunity for us to really have some educational conversation around expanding the definition of sex to be more inclusive.
Mm-hmm.
Absolutely.
Excellent, for sure.
Because as I said, I'm a big fan of people feeling like they can have successful sexual experiences, whatever that looks like for them, right? Whether they're alone, whether they're with a partner, whether they're young or old, as a person who, has gone through menopause in the last couple of years. I have lots of conversations with people about how our bodies change, right, as we get older. And so here we're going to talk a little bit about what it might look like for somebody with a vulva, with a vagina, to want to have outer course. And so, as we've already said, all of the genitalia in all of us starts out with the same origin story, right? Emily Nagoski talks about this, that, it's all the same tissues. It's just arranged in different shapes, right, and fashions. And so because of that, we can imagine that if pleasure And enjoyment of sexual touching for a person with a penis involves arousal, right? Both psychogenic and physiological arousal. Then we can imagine that a person with a vulva, with a vagina, also benefits from arousal, which looks like engorgement, right? Which looks like uh, overstimulation of nerve endings, which looks like the manager parts of the brain sort of checking out so that the arousal parts of the brain experience can really show up. And so the things about outer course for a person with a vulva and a vagina might be super important because, as I sort of crudely tell my clients, rubbing on dry parts doesn't feel good. Rubbing on parts that aren't aroused doesn't feel good. So what are the things that we can do to create some arousal so that we have the maximum experience? Here it talks about stroking, tapping, licking, using toys like a vibrator, an insertable or an external. Those stimulation efforts might be focused on the clitoris, but they may not exclusively or even at all be focused on that. So somebody may really enjoy having, their thighs squeezed or bitten. They may really enjoy stimulation of their breasts or their nipples, their ears, their neck. You talked a little bit, Susan, about people, touching in a circular form or, right, an up and down pattern on the labia. I've had clients who really love to have somebody bite or have like pulling, really hard, intense stimulation on the labia. Other people might say, oh my gosh, I wouldn't enjoy that at all. So trying to figure out what kind of stimulation might feel best to somebody. I think that this part where it says that outer course can include anything that someone considers to be sensual or sexually relevant, right? And can include other kinds of activities like erotic kissing, touching other parts of the body. It can include visual or auditory stimulation. Again, things that create a feeling of arousal or eroticism.
Yeah, and you bring up I think a really important thing. You brought it up first, Susan, is like, especially if the lights aren't all off and somebody is going down to these areas, you're very vulnerable. It is a very vulnerable situation. A couple things that I think are important. I was thinking of when you were talking to Alicia. I don't want to forget consent is super important. And consent as we move through sex, is it changing? Paying attention to that is really important. What they want, what they don't want, what you don't want, and making sure that that consent is always there fully and completely with whatever you're doing, because everybody's different in what they like. And so you want to make sure that consent has been fully negotiated, and it's a dynamic ongoing process. It doesn't end when in the beginning they say yes, but then now maybe you're doing things they're not comfortable with. So checking back in, making sure that consent exists is super important. I just was thinking about that because yes, some people love to be even bound, bitten, licked, all these different things, but there has to be consent underneath all of that.
Sure.
I completely agree with you guys. You know what else I think can be really uncomfortable is beyond consent. What if something is not feeling good? How does a person tell their partner, harder, stronger, longer, go left, go right, go north, go south? We are not socialized to have that language.
Sure.
Look about, what do people say when they want to have sex? They go, "You want to get busy? Let's take a nap." They like those are not, "I'm feeling attracted to you and I wish to make love with you." Let's not. They do that in the movie sometimes, but they sure don't do it most of the time. They certainly don't do it in the backseat of a car when you're a teenager or wherever,
Right.
So part of I think the beauty of outer course is challenging the couple to really kind of either show me or tell me or use language, develop a language with one another so that you can say what you like. It's very cavalier for healthcare professionals to say, "Oh, well, tell your partner what you like."
Right.
words do you use?
Yes.
So I'm going to open that to my co-presenters today. Give me some ideas.
I think you're absolutely right. I think in general, our vocabulary is, oh, yes, yes, things like that, right? That's our vocabulary. They're not sentences. So I think sentences are really important. And also, back along what I was saying earlier, do you have an escape word? Do you have a safe word that that you want for things when it is uncomfortable? That can be something you could incorporate. Some people like that. But I teach I think the more you talk about it, the easier it is to talk about it more. The more you avoid it, the more difficult it is. So I say, let's start talking about it. And sometimes when you're having those creative, fun discussions, they're not necessarily going to happen in the throes of sex and maybe shouldn't happen in it. Maybe they're happening outside. My one patient's called it pillow talk. They'd kind of chat about it all, not when they're having sex, but just lay on the bed, cuddling together, saying, this is something I'd really like to explore, or would really like, but you bring up a great point, because we all know a place that feels fabulous can become hypersensitive in a second. And all of a sudden it's like, nope, you got to stop that. That's it. And then letting them know in a way that says, I love you, but stop, because now it's irritating me, even though it felt good a minute ago. Right.
Right. Exactly. I think another thing a lot of couples do is they do this reflection thing after, to your point, Jeff, not in the smack dab in the middle. Nobody wants major corrections smack in the middle of everything, but afterwards, sometimes to say, what my favorite part of our time together was blah blah blah, and probably we could skip the part where blah blah blah. And it doesn't mean that your lover is a poor lover. It's that your tastes may be the same. They may have changed since you went through menopause, or they might have changed since you had your prostate removed. Like, you never know. And so my favorite part and my least favorite part, it doesn't mean you're a terrible lover. Again, my favorite and my least favorite part. That's a very gentle and kind way to bring up those kind of conversations.
Yeah.
Right. I agree. Communication is super important. And also, many people feel uncomfortable or don't feel like they have kind of the language or the confidence to describe things. I have a couple of checklists that I will give people if they're wanting to explore, and it will have different kinds of body parts or sexual activities, and whether, some of them are like red light, green light, yellow light. Red light, I never want to do that. Yellow light, I might be interested in certain circumstances. Green light, that's always good with me. I really enjoy that. Susan, I have lots of people after the fact say, find a safe and comfortable place, at some point, and say, one of the things I was surprised about, or something I really enjoyed, or I was curious about, or this felt great. In the middle of sex, we all feel pretty vulnerable. We feel exposed. And so, gently guiding your partner's hand somewhere else, or asking in a kind way, could you try that a little softer, or in a different area of the body. I'm also a big fan of what I refer to as sequencing. So you may really not enjoy something at one point in a sexual encounter, and at another point find that really desirable.
Yep.
So someone may touch your body and you're not fully aroused, and so that doesn't feel good. But then at a different point, and one of the things that can happen without good sexual communication is you try something, your partner sort of moves away from it or isn't responsive, and you clock that as, they don't like that, I'm never going to do that again, instead of, 5 minutes from now they would really enjoy that. Right. And so some of those conversations about, especially if we've had some sexual functioning challenges and we're anxious about arousal, we're anxious about capacity for orgasm, right? We're anxious about some of those things. We might find ourselves rushing and not slowing down to allow for pleasure, allow for curiosity. And so, I ask people to remind themselves that no one sexual encounter is going to be the only sex they're ever going to have, and that there's lots of room for slowing down, for checking in, for figuring out, for learning, for being a little silly, for having a good time. And so kind of taking some of the pressure off of it.
Yeah, it's like at this age in my 60s now, it's like you may be going, oh, and it may be, oh my God, I got a cramp in my hip. It's not a good oh, it's not a good oh, it's a bad oh. So,
Yeah.
so I think that's important. And even like you said, sometimes you think about it in the movies, you're like, oh, everybody, it's like rip the clothes off and have quick, sex.
Right.
And
Well,
sometimes
they come together, there's three pumps, and then they both explode into spontaneous, simultaneous orgasm.
Simultaneous, right? Yeah.
And there's nobody ever has
everything's
anything running
smoking.
down their, nobody ever has anything running down their leg after. I'm like, there's no consent conversations. You're exactly right. The setup is strong. The setup for us to have unrealistic expectations. And so I like to remind people all the time that your body is wonderfully made, that your body knows how to do what it wants to do.
Mm-hmm.
And your job is to create experiences where you feel safe enough that the fear responses, right? The guarded responses, the willingness to engage, can really further the experience. And then it's just, a little trial and error.
Absolutely. So, do people have to have the genitals involved at all in order to have sex? That's my question for you guys. I'm going to answer it right out of my gate, and I'm going to say no. That great sex can happen with no genitals involved at all, and sometimes the stroking, the cadence of stroking, and the sensations of tenderness and kissing and things like that can be even more erotic if you think of times when people play before they become genitally active, I'll say, how arousing that can be. And often it's kind of a fun experience to take genitals off the table, not literally off a table, but off the table,
Right.
and even keep underwear and bottoms on and just see what develops with just touch on body parts that aren't genital. And that would include breasts in this particular exercise. It's a fun exercise to do.
I would totally agree. And I think too, explore, you're never going to know about those places if you didn't explore it. Think about how maybe your inner thigh feels when certain things are done there, or think about, it could be anywhere, but like behind your ear, the small of your back. I don't know, but you'll never know unless you explore those non-genital places. So I agree wholeheartedly. And also, like the other point is, so that quick and fast, like we see in the movies, sometimes that's what people want, sometimes painstakingly slow, and it changes from day to day. So mix it up. But I agree wholeheartedly with you, Dr. Kellogg, that sex is so much more than genitals even. And how fun to explore. Don't go near them. Don't touch them.
Yep. Just leave them wanting more, right?
Right. And it's not even because your parents said you couldn't this time. It's because you don't, because you're exploring. So I think it's great. Real quickly, I'm going to go through the last slide, which is pleasure for someone with a penis. And again, you already know the outer course. It can be manual stimulation, which is rubbing with hands, rubbing the penis across the clitoris with a little bit of lubricant or something as well. Even sometimes people, and again, you have to figure out what works for you, but the head of the penis, the shaft of the penis, rubbing against the clitoris or that area. Sometimes when a vaginal penetration isn't comfortable or possible, the woman has her thighs together and the penis goes right in between there where it's rubbing the clitoris as it's moving back and forth. But any of those rubbing of genitalia can be part of it. Rubbing of the penis, the testicles, the rectum, any other erogenous zone. We just talked about all these crazy places where you may feel this fabulous stuff. But it's going beyond the genitals. Outer course could include caressing, massaging, kissing, licking various parts of the body, exploring sensitivities, the feet, the toes, the hands. Again, and if you have, some people are a little uptight about some of that, you could have just come from the shower or even do some of this in the shower if that's more comfortable for you. And remember too, on a man too, everyone is different. That perineum, that rectum, everything we talked about earlier, exploring with permission and consent and each other working together, the person with the penis, what feels good to them. I think that's really important. And remember, now this involves this emotional intimacy, and how fun that can be to share fantasies. Susan, I say you could have sex. You could have sex in public at a fondue place by having a wonderful meal where you're feeding each other. Now, we've all seen those people. Sometimes you're like, oh my God, get a room. But we're saying that because we're kind of jealous that this wonderful thing is unfolding for this couple. They're not on their phones. They're completely engaged and they're feeding each other. So,
Absolutely.
right?
Absolutely. And that's really erotic because they're in, you're using food as a connecting device, I guess you want to think of it that way. What's more erotic than an amazing meal shared with an amazing person? And yeah, it's in public, but you're not doing anything that's illegal. So sure, what a great way to have sex. Because remember, all sex is pleasure. It's a pleasure production. The fact that we happen to put it in the genitals is one thing, but there's so many areas to have pleasure and so many senses, so many smells and sight and tastes that are so erotic.
Yes.
So pleasure producing, I should say.
You can take down the slides, Vic, because we have so much to chat about. We don't need the slides up anymore. But so, and I'm thinking of everything you're saying, Susan. So you could do that at a restaurant. And if you're like, oh God, get a room. Okay, so get a room. Throw a tarp over. So go to a hotel, which can be fun too, or throw a tarp over your bed and get out the sauces and desserts on me, baby. Be fun and creative. And again, don't think, oh, it all goes in the genitals. It's like, put a little bit of that, whatever your favorite sauce is, wherever on your partner that might be fun to explore. And there's I love that, Susan, too. The smells, get into using all your senses, not just, we're programmed to the bases. And where we have to go is penetration. Whether we're with a partner of the same sex or not, penetration is where we're ultimately headed. No, not necessarily. Hey, the tarp and the desserts on me, this is a lot of fun. And
very cute game. Lots of people play that game and it's very, very fun. I have a couple that I worked with that were really struggling with, they literally disagreed on everything. Like his touch was too hard. He had calluses on his hands. Those were uncomfortable. She was too gentle for him and she didn't like that. And they just fought about everything. So they came up with this technique where they took, I know this sounds silly, but do you know the brushes that you could buy in a culinary shop to put butter on a turkey or speaking of sauces. So they literally got all different brushes and they decided to literally brush or paint each other's bodies with these brushes. They didn't use any sauces. They didn't use any paint, which you could, but they didn't. But they just used the brushes with all different bristles to see what each other would like. And you see, now it wasn't the calluses on the hands or it wasn't the hands, the cadence of the stroke. It was the brushing movements that were so erotic to each other. I thought that was such a creative way to have Outercourse, and they loved it.
Mm-hmm.
Awesome. I love it. That's such a great thing. And think of all the different sensations in the touch. Think about the different things you may have in your house that you feel comfortable with, like the feather duster, different things that might give a tactile sensation that you've never felt on whatever part of your body. How fun to explore some of that. And maybe, if again, with consent and stuff, with a blindfold. Yep. Do you have any idea? What am I touching you with? What's that? A feather? Whatever it is. And again, we have to have a level of consent and trust. But how fun to explore all of that.
Or blindfolding and open your mouth and tell me what's on this spoon. Tell me, what are you tasting? Are you tasting the beautiful tartness of a strawberry? Or are you tasting hot chocolate? What are you tasting? You tell me. Again, awakening those senses.
I love it. So many fun ways. Alicia, how about you? What are some of the fun things you found? I know, and I think what's difficult is all of us feel self-conscious and vulnerable about our bodies a little bit. So you're just like, but you are miraculous and beautiful. And when you can get a little past all that, and what's so funny is we see all the imperfections, but our lover sees the beauty of who we really are. That's why they love us unconditionally, and they're not seeing, well, you're like, oh my God, they're going right past that wrinkle or that scar that I have, or that testicle lies lower than the other one, or God knows what's going on. Get out of your brain and into your body.
Mm. You know, I appreciate this conversation and the opportunity to put back out into sort of the information sphere that, um, you know, penetrative sex is wonderful and it's intimate and connecting for people who enjoy it. And even people who enjoy it may not exclusively want to rely on penetration as their entire sexual repertoire. And so I find that, you know, there's a saying that desire at its purest form is that when you think about something happening, you want that thing to happen. Like, oh, I desire that. If you invited me over to your house for dinner and the last time I came, I got food poisoning, like, doesn't mean I don't like dinner, doesn't mean I'm not hungry, means I don't really want to accept that invitation because I have an expectation that that experience may not be a good one for me, right? And so one of the things that expanding our definition of sex and pleasure can do is inject a sense of curiosity, right? Of novelty, of exploration, of new sensation, of opportunity to get to be a different person or play with a different way of being, right? Sexual with another person. Because in my practice, I hear so much from people about, you know, being so busy, having so many other pressures. And so when we think about sex and we're like, well, I know what exactly is going to happen. I'm going to take my pants off. You're going to do this. I'm going to touch you here. This is going to go on for 30 seconds, right? It's like, it's all already mapped out before it gets going.
Mm-hmm.
And instead, if we say, right, I really just want to give you a full body massage, right? Or let me scratch your back. Or let's just make out in the driveway for 15 minutes before we go inside and relieve the babysitter and, right, put the kids to bed and all of that. To me, it just opens up an opportunity for people to be curious and, you know, playful and pleasure, you know, centered without maybe some of the, and not to mention all the other reasons why people might be a little bit avoidant of penetrative experiences, right? Pain, messiness, pregnancy, worrying about sexual performance. Like there are a lot of things that if we sort of pan back and expand our definition, I have this conversation all the time with people. And it's like, oh, I think my partner wants to be sexual and I don't really feel like I can get out of my own head enough. And I'm like, what if you offered your partner a hand job? What if you hopped in the shower together, right? I had did you lose me for a second? Okay. I had a client a couple a few years ago, and they did the cutest thing. They were like, we know we need to be sexual, but we've got kids and busy careers and whatever. And so one of the things that we'll do is we'll say, let's have a race. And they'll each touch themselves, right? Next to each other to see who finishes first. And the cutest thing, he said, she always wins, but I don't mind. And it was this playful, like nobody felt bad, right? We wanted to keep an erotic sort of nature to our relationship, but recognize we don't always have the energy, right? Or kind of the ability to fully engage. So that's what I love about this conversation is not to decenter intercourse as an important sexual experience for people that want to have that, but to recognize that it's often exclusive of pleasure-centered sexual activity for people with vulvas, right? That it is often uncomfortable for people with a whole host of medical or physiological, right, experiences. I mean, I think about people with arthritis and prostate issues and breast cancer and cancer treatments and vaginal dryness. Like the list, I could go on for hours. We want to make sex accessible, right? The experience of pleasure, intimacy. We talked a lot earlier. You were talking, Jeff, about, the dopamine and the oxytocin and all of these important experiences that happen, as Emily Nagoski talks about, get in the bed sex, where you just, you don't feel like being sexual, but you just get in the bed or on the sofa or wherever, and you put your skin next to another person's skin, right? And you smell their neck and you hear their heartbeat and you feel the warmth. And then your body starts to go like, oh, I like this. I enjoy this, right? And that's what I'm always trying to do, is not dictate what sex looks like for anybody, but to help people feel more accessible. And I'll end with this. I sometimes tell people that I think the traditional view of sex is like, you've ever been to a bar and they give you a cocktail with one of those little paper umbrellas in it, right? And I'm like, the sexual umbrella is that, and it only fits penis and vagina intercourse, right? And I'm like, we should have a beach umbrella. We should have a party tent, right? That should be your sexual umbrella. You want it big and it can fit a lot of ideas and a lot of experiences under there, so that you're well prepared for a lifetime of pleasure. Connection, right? And joyful eroticism, because all of us, if we have a limited script, are going to find ourselves coming up short at some point.
Wow. That's some great final thoughts, Alicia. I appreciate that so much. Those are so great. It's so funny. I just had a couple who was like, they're older and they're like, oh my God, we're staying with her mom right now. And we're supposed to be working on our sexual homework from you. And it's really hard. And I'm just like, where's your car? Well, it's out in her garage. I'm like, get in the car. I'm like, go get in the car. Go get in the car. And they're like, get in the car? We forgot. That's a great idea. I'm like, go get in the car. I'm like, you can't get into trouble. It's city, just make sure that you're able to breathe out there and everything's good. It's in the garage. You're good to go,
Right.
So
that's great.
I love it. I want to do a little centering exercise, and then if you have any final thoughts, we will finish up in just a sec. But gosh, we could go on and on. There's so much good stuff to unpack. What a great episode. But as we close today's conversation on Outercourse and creative pathways to pleasure, I invite you to take a moment to return to your miraculous, beautiful body. Not with pressure, but with gentle curiosity. You heard Alicia say that word, and I think that's such an important part of all this is curiosity and a little bit of love. Curiosity and love on it. If it feels comfortable, allow your eyes to close or soften your gaze, whatever's comfortable for you. Make sure you're in a comfortable position. Begin by taking a slow, deep breath in and exhale fully, letting any tension melt away out of your body. Now, you can place your hand over your heart, one hand over your heart, and one hand on your body, wherever it feels comfortable. Your chest, your belly, your arm, your thigh, whatever feels right for you. One's over your heart, one's over wherever else you want to put it on your body. The other hand. As you breathe, those big inhales in, and that melting, slow exhale out. Let yourself notice your sensations. Notice the warmth of your hand against your skin. The rhythm of your breath as you're breathing deeply. The textures around you, the chair beneath you, the clothing you're wearing, the sounds that surround you. Without judgment, simply let your awareness rest in your senses. Now gently remind yourself, pleasure is not a performance. Pleasure is not a performance. It is a journey of sensation, connection, and presence. My body is allowed to experience joy in many and various ways. My body is allowed to experience joy in many and varied ways. Outercourse is an invitation to creativity, comfort, and connection with myself and with someone I care about. Take one deep breath, this time breathing in the possibilities, and then exhale with ease. When you're ready, gently open your eyes, returning to your day with a little more softness, a little more awareness, and perhaps a renewed curiosity for pleasure in all its forms. Well, I would like to thank you for being here with us. I'm going to bring my guest back in a minute, but first, Vic, what's up next week on Dr. Jeff Talks About Sex and Intimacy?
Dr. Jeff is joined by Dr. Ann Katz as she explores how cancer and its treatments can impact intimacy and the relationship for both the patient and their partner. She provides strategies for navigating intimacy and rediscovering what feels pleasurable and adapting sexual activities for the enjoyment of the couple. Dr. Katz has a new book coming out in February, and this episode will be a sneak peek into some of that information. Join us on November 4th at 7 p.m. Central Time to learn more.
Oh, gosh, what a great episode. And we could go on and on. There's so much to unpack. We got to come back to this subject again, and I would love for you both to come back and we will talk some more. But any final messages for our listeners from either of you?
I'll start. You're never too young and you're never too old for Outercourse. So it's if you've never had Outercourse, if you've never had this creative process and you're listening and thinking, oh my goodness, we're in a rut. We do the same thing every Saturday night at 11:05. And I don't even know how to get started. Just get started. Say, I saw this great podcast. I would like to start with something safe if you like. I'd like to give you a back rub this week instead of our 11:05 intercourse. Just see how it works, but give it a try.
Awesome.
Yeah, I agree that, I think my goal is to help people combat shame and sort of anxiety around sex and to really prepare themselves to be sexual, sensual, full expressions of themselves throughout the lifespan. And that looks different whether you're partnered or not, and right, what condition your body's in and what your experiences are. But this is a reminder that there are lots of ways to really celebrate relationship, to celebrate your body, to celebrate your sexuality.
Yes, wonderful, wonderful tips. And I want to remind listeners, you know what? You're not alone. If you think, oh my God, like seeing this body naked at 63, it's like it's not something I want to share with anybody. But your partner is your lover. They're not judging you, and you are so worthy of love and belonging. And your body is miraculous and beautiful with its flaws. With those maybe stretch marks, with those scars or whatever it is, or whatever you think is wrong with it. It's beautiful. It's miraculous. And I hope you embrace all the things that it could be for you with your partner and your partner too, just to love a little on yourselves and your body. And that's my hope and prayer for you, is that you learn to love and accept yourself. And it's something I work on every day. So you're not alone. But thank you so much, Dr. Kelligspat, Alicia Williams. What a great episode. And thank you, listeners. You're what it's all about. Have a good one.
Dr. Jeff talks about sex